Sani Bello Foundation and Graceland Healthcare Development Foundation organize free surgical intervention to commemorate the birthday of our beloved father, Colonel Sani Bello, the chairman of Sani Bello Foundation, which we organized to solve the problem of at least 1,600 people.
We are very happy that it was organized at a short notice, and a decision was taken that people should benefit from the birthday as against other activities. And we came to operate about 200 people for general surgery and 50 people for eye surgery.
But what makes this outing a little bit special is like we expanded our activity to involve eye surgeries. We had serious incidental findings. A lot of people are blind here because of operable or blindness that can be prevented.
The project has been so good. The turnout of patients is tremendous, and there are high expectations. A lot of people will benefit. So far, it started yesterday with screening process. I had too many patients, and it's really good. So far, yesterday we saw close to more than 200 patients just for the screening under ophthalmology, and then for the expected number of patients to benefit from surgeries, we're going to have at least 50. So for other minor surgeries, we have like 10 to 20, which is a good number.
But fortunately, on coming, we saw the number of people that were present, and I think we've operated up to 250. Then plus 50 surgeries, above 50 surgeries for surgery, apart from medications that were given free of charge to other patients that are neither for eye or general surgery.
Today, by God's grace, we're going to have surgeries for cataract patients and for other minor cases like pterygium and chalazion, and they are all going to benefit by God's grace.
We are expecting to do 50 cataract surgeries and other minor procedures like chalazion and pterygium excision. Sani Bello Foundation has been a partner in progress in collaboration with Graceland Foundation. It's a pleasure to help humanity, and we are pleased to be part of this. We know that Sani Bello Foundation has been doing a lot of things, but we identify with them more in respect with healthcare.
It's been a very wonderful thing. You see a lot of people. I saw a family, a particular family. The woman came with her 2 children, having cataract, blind, 2 small children. So for such things like that, they are really helping humanity, and we appreciate him so much. We appreciate the foundation so much for the great thing they are doing, and may the Lord continue to bless them.
But from everything I've seen, I went around, I saw how that people's surgeries are going on, people are being operated upon and all, and then they are being on their feet. I interfaced with a few of the doctors around, and what I've seen is quite encouraging. I have nothing to say else than to just applaud what the Sani Bello Foundation is doing, and I also pray that God will give them more grace to their elbow to do more.
The first day we came, we started the screening. We have to do at least 20 patients before we left. Yesterday we do 128 patients. Today we've done about 97 patients, and our expectation is just to do 200. We look at it, and we still have a lot of people outside waiting. This is a very good program. That's why people are trooping in.
As you can see, the doctors, the medical teams, all of them, they are doing a great job. The patients too, they are over there sitting down, waiting for their turn. And I think to God be the glory. This is working where it's expected.
So far so good. God has helped us to be able to render services, help to many people that come with different kinds of ailment, ranging from fibroid, from appendix, from hernia, some of them with lymphoma, some of them with thyroid, many of them giving assistance.
People are really benefiting. If you go outside there, you see people that are seriously sick. and there's no money to do these things. But with the help of Sani Bello Foundation, a lot of people have benefited. Just like we said, we were supposed to do 200 patients, we did 250 extra, and we still have patients on ground that have not got it.
I think the people of Kontagora should be very happy and very grateful that they have somebody like the chairman of the Sani Bello Foundation who can give to the people, because it's not easy to actually operate about 2,000 people for the past 3 years. Because if we cast our mind, some of the operations that we are doing, like TARES for example, myomectomies, and all these big surgeries in other hospitals and everything, they might cost up to between 100 to 500,000. And these are done free, and the people have been doing well. The records and everything will show that the operations have been very successful. And this year,
it's a nice thing. The foundation is really helping the masses out. For those who cannot afford, I think it's time they would afford Medicare. Kudos to the foundation.
I would say things should be extended or continued so that at least a lot of people should benefit. As I'm talking now, there is still need. If we can extend 1 or 2 days, we will see patient. So I think it's a very good thing we are doing, and I commend the organizers of this program because they are actually doing the right thing and a good job. Because it's touching a lot of people from the grassroots, and we are very happy about that.
It is our belief that within this period, people will benefit, and there is nothing as good as giving service to humanity, especially those that cannot afford. All these surgeries we are doing for them, these are surgeries that will have taken them a lot of money to go to Kaduna and other places to go and do, but we are bringing it down here to Kontagora. It is our expectation that at the end of the day, people will have their sight back, and those that have ocular challenges will be restored.
Taking for them had cataracts, and we targeted only 50, but at the end of the day, we operated over 60-something patients. So this is a really big achievement. We will want to propose to the Sani Bello Foundation because this is an incidental finding, and so many patients are left behind. We look forward to continue our relationship with this organization and then encourage them to continue to touch the lives of people in different ways.
1,000 people has benefited on eyeglasses. 67 people benefited on cataract surgery and pterygium, and 200 people, or I can say 222 people benefited on different kind of illness on surgeries like appendix hernia, goiter, pterygotomy, and the rest, where about 300 people serve with medication of eye that is not required surgery.
The purpose of this is that by his nature he likes giving back to the people. He likes to put smile on the faces of the people. He wants the people to always rejoice. He's a man who doesn't like partying instead of all this gathering of people to eat, dance and so on. So instead of that, we have organized this medical outreach, free surgeries in collaboration with Graceland Healthcare Development.
This program, honestly, I have never seen something like this. I see different illnesses and I wonder if these are truly happening to human beings. And when I get to understand the cost implication for each of these, I wonder, and I see people who truly cannot afford this. How will they come out of this? But thanks to the philanthropists like Sani Bello retired, with his foundation, Sani Bello Foundation, putting this up together, I think this is a blessing, not just to Kontagorians, but to humanity, residents of Kontagora, people around, like people coming from Kaduna, Kwara State, different parts of Nigeria coming to benefit from this. This is a huge one, and I say may he live long, and I wish others can learn from this and see how they can be a blessing to their community. Even I as a person,
for 200 persons, and then 50 surgeries also for eye issues. We discovered that instead of gathering people